Hello and welcome to OnFM and the Talk Hour with me, Samina Kiyani. The topic today, therapy. Almost 1 in 5 Britons has consulted a counsellor or a psychotherapist, according to a 2010 survey by the British Association for Counselling and Psychotherapy. People seem more open to seeking help. However, the stigma attached to so-called talking therapies still appears to remain. Also, what about the costs involved? Is therapy just for the rich and famous? Apparently not. We live in one of the richest countries in the world. However, our levels of depression and anxiety are also some of the highest in the world. Do we get stressed over superficial and trivial things like, I'm a bit overweight, I want a more expensive car, I want to live like a celebrity? Do we take things for granted? You tell me. Are you feeling stressed by our modern existence? Are you considering therapy but don't know where to start? Perhaps you have particular thoughts and ideas on therapy. Let me know. Email in studio@onfmradio.co.uk, or you can post on our Facebook page, or you can Twitter @OnFMRadio. Okay, to give us an insight into the psychological therapies, affordable and low-cost therapy, and to discuss the state of the nation in general, I have joining me now Joan Baxter, CEO of WPF Therapy, a leading charitable provider of talking therapies. Joan, welcome to the show. It's good to have you here.
Hi, Samina. It's very good to be here. Thank you for inviting me.
Oh, no, my pleasure. So, figures from the survey by the British Association for Counselling and Psychotherapy suggest a big shift in attitudes towards talking therapies. Despite people seeking therapy, 1 in 5 as a matter of fact, why are things not more open, and why are people not willing to talk openly about such matters?
Well, Samina, I think things are improving, and I think people are more open about it than previously. But I think people are anxious. I think people are very anxious about how they'd be perceived if they share the fact they've had a problem, if they share the fact that they've sought therapy. I think they might be seen as weak, they might be seen as vulnerable. And I think historically, I think we're a nation where we've tried to encourage people to, keep that stiff upper lip.
So are we talking about, let's go back to, say, the World War I and II, when actually impassive attitude was actually promoted, keeping the stiff upper lip and so on, as you've just mentioned. Do you think it's a legacy of that still?
I think it's probably a feature of our nation. I mean, obviously we're a much more diverse country now than we used to be. I don't think it's just due to attitudes during the First World War, Second World War, when, everybody had to kind of pull together and put up with all sorts of privations. But I think probably historically, going back in time, one of the ways that people in this country culturally have coped with anxiety is to put a brave face on things. And I think, we've probably encouraged young people to behave in ways that, don't involve sharing their difficulties, sharing their anxieties. We don't go around wailing, for example. In some nations, people wail openly when they have suffered a loss, a bereavement.
For example, in the Middle East, when there is a death in the family, they're very open about expressing their loss and grief.
Yeah.
You're right.
Absolutely. And here that would be seen as a weakness.
So, as a nation, we're not good, perhaps, at prioritising our emotional and psychological health over other things?
I think that's right. But, I also think that we've got to be realistic, that people do suffer negative consequences sometimes. In work, for example.
Again, it's going back to the stigma attached to...
The stigma, that's right. So people have to be confident that if they speak about having therapy, they speak about having psychological problems, people will be compassionate, they'll be understanding. And I think more importantly, people will be able to say, actually, yeah, I felt like that too. Because having psychological difficulties is very common. In fact, it's normal. In fact, everybody...
I was just going to say, I can't imagine there's one person out there who hasn't gone through some difficulty in their life or some emotional trauma.
And if they haven't, there's something wrong, because everybody suffers losses from time to time. And if you don't feel them, and it doesn't make you feel down for a time, and that's perfectly normal...
Then that's a problem in itself.
That's a problem in itself. People who don't feel have problems.
Therapy is pretty commonplace in the United States. It seems like every other person goes to see a shrink, as they refer to it. We British tend to have a more sceptical and reserved attitude towards it. Why do you think our attitudes differ so much?
That's a difficult one. I think in the States, there's a culture that encourages people to grow and develop. expressions like self-actualization have come from the States. And I think in the States, it's become acceptable to see therapy as something that isn't just about getting over traumas and difficulties, but that is also part of growing, learning about yourself, learning about how your mind works, enabling you, for example, to feel more confident, to, understand what your demons are so that you're not so anxious about them.
Is that the only way to see self-progression or self-awareness through therapy?
No, there are lots of different ways in which people will grow and develop. Quite often people will say to me, well, if you've got a good friend, surely that's as good as having a therapist. And we know that friendships are really important. We know that in terms of having good mental health, having at least one really good close relationship is a very good protective factor.
An outlet to go express yourself and talk about your innermost whatever you're going through.
That's right. Yeah. There are lots of ways in which people can learn and can grow and develop and learn about their mind. But there's something special about therapy. I mean, one of the obvious things to say is that therapists are specially trained to do this work and to listen to people and to understand, perhaps what's behind what people are saying. We put our friends in positions very often where we kind of encourage them to tell us what we want to know, whereas therapists are specially trained to listen very carefully, to pick up what people aren't exactly saying directly, and they're specially trained to understand where that fits in terms of how the mind works, how the mind develops.
Sort of reading between the lines, so to speak.
It's a kind of reading between the lines. I mean, the kind of therapy that WPF Therapy espouses is psychodynamic psychotherapy in particular, where we're very much looking out for these messages between the lines as you describe them, and also looking out for the kind of role that clients put the therapist in, because we all in our minds have kind of prototypes based on early experience, expectations that we set up for other people. And therapists are very tuned in to picking up what people are trying to do to them, what clients are trying to do, what role they're trying to put them in.
Right.
And that helps therapists to understand what's important in the way this particular client manages their relationships. Very often people come to us because they're having some difficulty with relationships. They want to learn more about that. Why do I keep getting into the same kind of relationship? Why do my relationships... Repeating patterns. And our therapists are specially trained to pick up what it is about relating, and after all, a therapeutic relationship is a relationship primarily. What is it that this client is doing? And then the therapist can reflect that back in an appropriate way and at the appropriate time so that the client can learn something. So that's really the difference between therapy and a friend. We're talking about a professional, somebody who's trained to do the work.
Who can look a bit deeper and beyond what a friend might, because friends, of course, they're fantastic, they give you support, but sometimes you might have something very personal going on that you don't want to share with anyone, including a best friend or a family member.
Yes, and you're much freer with a therapist, actually, because you only know the therapist in that situation, and there's a boundary of confidentiality around the therapeutic relationship. So you know that your therapist isn't going to go and chat to the friend you have in common. Your friend is going to be somebody else's friend as well.
That information is totally secure.
It's totally secure.
It's not going anywhere.
It's not going anywhere. Yeah, that's absolutely right.
So with WPF, you mentioned the process of interacting with clients. What different kinds of talking therapies do you provide, and what's the significance of each?
Yes, well, everybody's different, so that's a starting point. What's right for one client, won't be right for somebody else. So we offer short-term therapies and we offer longer-term therapies. We think about what the client is bringing to us. I mean, sometimes clients come with a particular problem they want to overcome. So for them, they may really want a short-term therapy that's focused on the problem, and so we might end up offering them CBT, which is a kind of therapy that really helps people with their thinking, with their thoughts.
Is it a more intensive therapy?
It's not a more intensive therapy. It tends to be quite a short-term therapy, so no more than, say, 10 sessions, 12 sessions, something like that. It's provided increasingly through the NHS. Statistics at the moment suggest that about 40% of people who have CBT will improve significantly. Other clients actually want to do, if you like, more work on themselves. They actually want to understand the feelings, the emotions, early experiences that are behind some of their behaviours.
So is that about becoming more self-aware? They're more interested in self-awareness?
Exactly,
right?
Exactly. And some people's problems are really quite deep-seated. And so for those clients as well, we would recommend a longer-term therapy. Sometimes people come to us and have CBT, or they go somewhere else and have CBT and find it very useful, but they want something more, so they will come back to us and they'll have some longer-term therapy, or they'll have CBT, which is very much about thoughts and behaviour, and actually they want to think more about their feelings, and we offer both short-term and longer-term therapy that's psychodynamic, that does just that actually connects people with feelings.
A little bit more tailor-made to what your requirements are when...
That's right, and we also offer group therapy. When people come to us, they have a first session, which is a consultation, and that helps our therapist who's doing that consultation to learn more about the need. But they also have the opportunity to talk about what kind of therapy might be suitable. And with group therapy, sometimes it's recommended where there are social issues, because, you know, in a group you have a social situation.
Yeah, that's right.
But also there are people who come because they've got particular issues. So, for example, at WPF Therapy, we have a gay men's group, and, you know, obviously, you know, gay men don't necessarily want to go to a gay men's group. They might want to have an individual session, but sometimes their issues are around being gay in our society, and for them a gay men's group might be exactly what they want. People can also move from one kind of therapy to another, and quite often we think that you know, people would like to have and would benefit from one-to-one therapy, but then at a point in time, group therapy might suit them.
Depends on your requirements and how you're progressing, I suppose.
Exactly, and people will, you know, bring therapy to an end, they'll carry on with their lives, and then, you know, people go through various developmental changes, and they may think, actually, I've got some unfinished business here, and they come back in.
So there's always room to go back and stop.
Absolutely.
And start. And
I mean, it's important to say, perhaps, that the majority of people who come to us have had some kind of therapy somewhere else before.
That's interesting.
That's what we're noticing recently.
I'd like to mention an article I came across during my research on the BBC website titled "Money Woes Linked to Rise in Depression." Prescriptions for antidepressants, drugs such as Prozac, rose by more than 40% over the past 4 years. Is that surprising, considering the current government have been increasing access to talking therapies?
Well, I mean, this is quite a complex area, and there's lots of things that one could say about that. But I think that people are nowadays more psychologically minded. I think people nowadays have more expectations from their lives. So I think people are not prepared to put up with being unhappy in the way that they once were, and that they look around to see how, you know, what they can do to feel better about life.
Managing yourself like you would manage your job or anything else?
That's absolutely right. And there is now a growing evidence base that therapy works. We know it works. There's a lot of evidence that for some people, for a lot of people, it really does turn their lives around. And the great thing about therapy, unlike, say, drugs, is that there aren't any side effects. It's not going to, you know, with some drug therapies, people, you know, feel a loss of libido, they slow down. Whereas with talking therapies, you're not going to have those kind of chemical kick-ins.
On your website, wpf.org.uk, you explain that you charge people on an income-based approach. How does that work exactly?
Well, as part of the initial consultation, there's a conversation around people's income.
Means tested?
We don't means test in the way that, you know, if you go for benefits, somebody's going to ask you to fill a form in. We ask, a lot of it's based on trust, and we ask people what their income is, and we have a sliding scale, and we do a lot of training. We do various activities that enable us to make a little bit of a surplus of income, and we use that income to support and subsidise our therapies, so that we can actually offer below our costs therapy to people who otherwise couldn't afford it. We offer low-cost clinic to students. We also have contracts with, for example, we have contracts with some universities, which enables us to see students free.
Right, gives them an outlet.
Because the university's paying, and so on. And we have some NHS contracts. We're doing some work at the moment providing life histories group work to older people, and we're really excited about that. And that's actually free to the older people who participate in those
So
groups.
we're talking old age pensioners, you have to be retired?
Over 60.
Over 60.
Anybody over 60 who's isolated or who thinks they could benefit from this sort of group.
And all this information is on your website?
It's on our website.
Okay.